what happens if the CLL comes back? You could, if the duration of response is long enough, you could repeat the chemotherapy. Another option is to go directly to the targeted therapies. You can look to see if there's any clinical trials with novel agents. And there are cellular therapies, CAR T, which I will not talk about, but I could answer questions about it, and allotransplant. Idelalisib, we discussed, and the reason why it's approved is because it was shown to be better than rituximab in a randomized trial where they compared rituximab and idelalisib versus rituximab, and a clearly superior outcome. And this combination is effective in patients who have also had ibrutinib. Venetoclax kills CLL cells that are, I call prime, meaning that you have you have lots of cells that are prevented from dying just because of the CLL, just because of the BCL2. And as soon as you remove the BCL2 with Venetoclax, the cells will die. And this is really rapid. It could be actually within a half an hour of exposure to the drug, which, if you know, when you're in the business of killing cancer cells, is awesome. But the problems occur if you have 400,000 CLL cells that all die at the same time. This collapse releases a lot of potassium and other components in the blood, and it's a situation what we call tumor lysis. And because of this phenomenon, there's a ramp-up phase so that we do not have an immediate clearance of the CLL cells in the blood. But this is also very active in patients who have 17p deleted. So we know that the Venetoclax will kill the CLL cells, and it doesn't matter if they have a 17p deletion. Young patients can be offered a potentially curative option, which is an allogeneic transplant, where this is the most extreme form of immunotherapy because you're taking an immune system from somebody else that will kill the CLL cells. There is a long-term survival in this. However, it comes at an increased cost, and that the mortality at 1 year is about 20%. So you really have to make that decision. Very few people are going to provide that option to young patients in the upfront setting. And now, as we're looking at all our treatment options, it is even more difficult to offer that, to offer allotransplant when you know you have ibrutinib, Idelalisib, and Venetoclax as an option.